Hi, this is Dr. Thomas Moshiri with Arizona Pain. I'm an interventional pain and spine physician, and I'm here to answer some of the commonly asked questions about some of the procedures that we do and some of the services that we offer. Okay, so who is a good candidate for radiofrequency ablation? So radiofrequency ablation is a procedure that usually follows a medial branch block. What it is essentially burning the small sensory nerves that innervate the joints in the spine. And these are not motor nerves. They don't affect your ability to move around. They are sensory nerves. And so all it does is it removes the sensation of pain that you experience as a result of either arthritis in the joints or things like that. So an ideal candidate is someone who has either arthritis in their spine, in their back, and or has some bone thickening, joint narrowing in the joints around the spinal cord. What are the benefits of radiofrequency ablation as compared to other treatments? One of the things that makes an RFA a really useful procedure for most patients is that it provides significant pain relief, and it can last anywhere from 6 to 12 months. As when you compare it to other procedures, there are other procedures such as a peripheral nerve stimulator, which is also something that we do, that can provide permanent pain relief. A radiofrequency ablation procedure is a great first step to make sure that we have the right problem identified and treated, and then if necessary, we can always move forward to other more permanent procedures. How are radiofrequency ablations performed, and are they a minimally invasive procedure? Well, a radiofrequency ablation procedure is actually not that difficult to perform. How it's done is we have patients come in and they essentially get on an x-ray table just like this one, belly down, and we use fluoroscopy, and with fluoroscopy, which is essentially live x-ray, we can identify exactly where the joints are and where the nerves are traveling. Based on that, what we do is we clean up the patient's skin, numb it up, and put a needle through the numbed area, and then inject some numbing medicine around the area that we're going to burn those nerves. Once the area is numbed up, then we use a very small probe that goes through the needle, and it generates heat around the tip of the needle. And that heat source will create a circular area of burn that essentially causes the nerve to disintegrate in that area, which essentially obstructs the flow of signals from the joint to the brain. And what it does is it essentially provides significant symptomatic pain relief for patients. Once that area is burned, then we take the needle out, and that's it. We just put a Band-Aid on the skin, and the patient can be discharged the same day. The procedure takes about 15 minutes to do, and it's completely minimally invasive. What are the potential risks and side effects of radiofrequency ablation? Anytime you have a procedure done, the main risks are infection, bleeding, and nerve damage. To minimize those risks, what we do is we use sterile equipment, we sterilize the patient's skin, and we work in a sterile environment to make sure that we minimize the risk of infection as much as possible. The other risks, which are bleeding and nerve damage, are minimized because we're using fluoroscopy and we're using live x-ray to see exactly where we're going, so we can pinpoint exactly where we're trying to land. The interesting thing is that nerve damage is actually our intended purpose behind this procedure, right? So we're trying to actually burn the specific sensory nerves that innervate those specific joints. And so that is one of our goals for the procedure. Of course, we minimize adjacent nerve damage to any other nerve that we don't intend to harm, by using live fluoroscopy and x-ray so that we can see exactly where we are and where we're going. What is the success rate of radiofrequency ablation? Well, I can tell you that if you've gone through medial branch blocks, and so that we've been able to successfully identify the nerves and or the joints that are causing your symptoms, then the success rate is near 100%. Many of my patients that undergo this procedure have significant pain relief and are able to get back to their normal daily life in a very short period of time. There is a bit of a healing time period that's required. Usually takes about a week to 2 weeks for the tissue to heal, and then thereafter you can get back to living your normal life. How do radiofrequency ablations improve quality of life? Well, in most of my patients that undergo this procedure, because prior to the procedure they're not able to move around and be as active as they want to be. And post-procedure, and once they've recovered, they are able to be as active as they want to be and don't have any pain. You essentially have 100% improvement of quality of life. You have patients, I have patients that come in and aren't able to go golfing, aren't able to go ride a bicycle and those kind of things, or even pick up their grandkids, and post-procedure can do all of that, plus more. So you have significant improvement in your quality of life after a procedure like this. Are there any lifestyle changes or follow-up care needed after radiofrequency ablation? No, there's no really lifestyle change that's needed. Really, the only follow-up care is to just check in with the patient, make sure that they're doing okay, recovering well, haven't had any complications from the procedure or anything like that. But typically, I tell my patients it takes anywhere from 1 to 2 weeks for the tissue to heal after a radiofrequency ablation procedure. After that, they can get back to living a normal life, and as a matter of fact, they're able to get back and do more than they were able to do before because they have had such improvement in their quality of life. Can radiofrequency ablation treatment be combined with other procedures for certain circumstances? The short answer is not really. A radiofrequency procedure, as we've been talking about, is a very specific procedure for a specific problem. So if we have a patient that comes in with multiple issues that need to be addressed, we'll typically address the one that's bothering them the most first. And then once we have dealt with that and gotten to the root cause and treated that, then we move on to the next thing. It's really important in medicine to be able to diagnose and treat a problem without muddying the water and not understanding what things are helping the patient. So typically we'll address one problem, move on to the next thing. Let me tell you about a patient of mine that underwent radiofrequency ablation. This is an older gentleman that had really difficulty being mobile, playing golf. He couldn't move side to side because of a lot of arthritis in his low back. And he's a patient that I saw in the clinic. We ended up examining him and obtaining some imaging studies. We were able to identify the levels in his back that were the worst levels that were creating the most amount of pain and problems for him. Once we isolated that area, we were able to perform a medial branch block and provide him with significant relief. And because he had significant relief with those diagnostic blocks, we were able to move forward with radiofrequency ablation. Fast forward 2 weeks after the procedure was completed, he was a new man. And he came into the clinic standing upright, and he was just so happy that he could now go out, play golf, and do the things that really make him happy and spend time with his grandkids. So, this is, again, one of those procedures that can provide significant life-changing treatment to patients that allows them to get back to a normal life.